Very good afternoon, very good evening to all the listener, and my special regards to Mr. Sachin for having me here on this platform on talking about this very interesting yet I would say very complex subject of healthcare at 20 years. We are still not covered from the COVID. I think we are still waiting as in India scenario. We are waiting for third wave to come, and then uh, I don't know what the future would bring into. Some people say that it is going to be last till until 2025, and still we have to take care of this deadly virus, and a lot of new variants are going to come. So, but my experience of last 2-3 years in COVID and before COVID, I will just share with you guys here. First of all, the COVID, I mean, if I talk about the using the smartphone, because it is all about the technology, and when we say the technology driven healthcare. So I think before a decade, so when I was asked this particular topic, I did little bit of exercise, because when we are going into past and when we see that what we have achieved, I think the smartphone was there for about 15 years ago, and then in last decade the people have started using the smartphone. The use of smartphone is something very great and amazing, wherein we do everything through this particular media. Be it this is not a simple cellular call, and we have a lot of applications are there which we are using for our day-to-day requirements. Similarly, on those lines, I'm also predicting that healthcare is also going to be like that. I'll just present few data in front of you. Then in year 2019, the telemedicine market and the funded in telemedicine was about $1.5 billion, followed by the analytics and data, that is $1.3 billion. M-Health applications, what we are using right now, that is $1 billion. Healthcare services, that is 487 million. Mobile wireless, $437 million, and clinical decision support, that is 425 million. Now, these are just the figures which I'm talking on 2019. If we compare these figures in one decade, maybe in year 2031, I think these figures will go skyrocket high, because all these things are, actually we are using at the 10-20% pace, and then we are looking forward to use all technology based healthcare. Giving you an example, wherein we just go for any shopping mall, or we step into any cafe or cafeteria. I have noticed that in the COVID time, there were QR code menus, and then we just have to scan the QR code, and the menu was right there in front of your phone, just to avoid the touch and handshake, and following COVID healthcare guidelines. On the similar part, I'm looking forward that hospitals and healthcare, I mean, if we talk about the healthcare, all your pharmacy, diagnostic services, hospital, all these services are there. Still, healthcare is lagging behind in terms of service standards. We are compared with the hospitality, but then yet our front office staff have to be taught that how to smile at the patient, because by smiling at the patient, only half of your pain and sickness gone, and that is on the mental health and counseling part of it. But that is now, because we have failed. I mean, healthcare as an industry yet to take a shape. But then, there are systems available. If I'm talking about all these healthcare app, I was amazed to see one solution which is available in the market. What that says that whenever the patient comes in the hospital, patient just have to scan their face, and by scanning the face only, one come to know that how much happy, sad, or whatever pain he or she is carrying. And then with the help of artificial intelligence, hospital management come to know, okay, these are the patients coming up with the sickness of this percentage, and then accordingly, if there are patients vulnerability, if patients are more severe, then you can align those patients in a particular I would say in a particular line or in a particular fashion, wherein they are given importance, they are given the priority. Similarly, those solutions are available for your employees. So while going into your organization, how much happy you are, and while going out, what are your satisfaction and how your facial reactions. So due to the help of artificial intelligence, I think so many this is one of the example. But looking at the Indian scenario, recently the Prime Minister have implemented on the fourth year anniversary of PMJY, that is PMJY Digital Healthcare Mission. Now, I look forward that mission is going to be boom in India, wherein your healthcare professional registry, your health ID, your healthcare organization registry, everything is going to be aligned. Everything will be, I would say, the registered. So it is coming from the India in as a part of, I would say, sustainable development goal and universal health coverage, wherein PM himself looking forward to cover every population of India, wherein every citizen has a PMJY card of different category, and they are given a cashless treatment in any XYZ hospital. Now that movement, if you see the PMJY, because I work in a medical college hospital, we have that PMJY test, and then we cater to PMJY beneficiaries. That whole department, that whole process is made in a such a way that everything is paperless. So I think the driver is PM himself, wherein such a technology, to have the EMR, to have the CDSS, to have the CPOE, your HMIS scanning, everything is going through in as far as PMJY patients are concerned. So it's the other way around. We want to cater our private patient, cater our paid patient, corporate patient in a fantastic manner. But here, the situation is quite actually reverse. PMJY beneficiaries are given a priority treatment. The green corridors are being made in the hospital, and everything is technology driven. So my message is very loud and clear. In Indian settings, a lot of main reforms are being placed as far as technology is concerned. The use of artificial intelligence, there are chatbots available equipped with the deep learning, algorithms are there. There is going to be a, nemo medicines are going to be there. That is in infant stage in 2019, but that will have eventually overperform all the branches of medical science, wherein you will have the designer drugs. The designer drugs will be more powerful than the ordinary drugs what we are using. So these are many new, agenda is there at the desk of PM, and I'm sure that government is actually, looking into such an agenda in a very rapid format, and all the healthcare organizations are compelled to follow. So if you see the digital payment, recent change in PMJY is every beneficiary will be paid, even their travel allowance with the bank. So even that is also not cash. So 300 rupees is to be given in that particular bank. So digital payment system is also introduced by government. So there are a lot of such changes are happening. Coming again to the hospital, when we are talking about the technology being used by the doctors, healthcare professionals, as we know, our doctors have a different mindset altogether. And I, coming from the medical college background, I always see that this is a challenge where, the senior doctors, senior faculties have an issue to use the EMR, to issue to, pen down or maybe to enter the data in particular file and particular patient's details. Maybe if we can address this, but my message is that if we can address this issue while in the education, if that particular module, if incorporated in UG and PG sections to use the healthcare technology, I think the nation will have lot of advantage. If you see the generation Z, which is there right now in our medical colleges or our paramedical students or nursing, like NABH. NABH started in year 2006, and now all the medical college have one module on NABH. So they are being taught medical vice management, infection control practices, the safety codes, code blue, CPR. There are so many other modules which are there in the curriculum. Likewise, if our doctors are properly trained and imbibed in the education system itself to use the healthcare technology, then and then all these agenda of Prime Minister, all the agenda of healthcare as a requirement can be considered. That is something which we have to think on, where in our education system address all these new forms. Besides that, if we talk about our hospital, apart from the education incorporating, all these modules, we have made a nodal officers group who are actually, there are like-minded people who appreciate technology more. So we want that one champion, could encourage other doctors to use this EMR. Of course, the decision making and everything is coming after discussing with them, involving them in the decision making, taking their views and make a system. So again, the technology to use is on our hand. We have to take people along while using the technology. So as I said, a lot of solutions are available, a lot of apps available, a lot of platforms are available where we can address like this. We are discussing healthcare technology. I'm really very sure that this will take a longer future. This will actually create an ecosystem where each and everybody in the hospital, each and everybody in the healthcare systems are aligned and make up a mind to use the technology, because the advantages are numerous, and that is what we are looking into next 2 decades now. So these are my thoughts on technology and my own experiences. With that, I would like to thank you each and everyone. I would be really happy to take any questions of yours if you have. Thank you.